very much, Chair. The Minister will be aware of the very high infection rates of COVID that continue amongst children, particularly those between 0 and 5 years of age. I got figures during the week about the levels of hospitalisation, which are strikingly high for those between 0 and 5. Understandably, they're the one category who aren't vaccinated. So the question is, what progress is the government making in terms of getting HEPA filters installed in childcare centres, in preschools, in creches, to provide protection for both staff and children?
Thanks, Deputy. So in December of last year, I announced a 10 million grant programme to improve ventilation and reduce transmission of COVID-19 in early learning and childcare settings, and that provided services with grants ranging from €1,500 to €4,500. And the rental of purchase of HEPA filters are among the items of eligible expenditure under this grant programme, and guidance has been provided on the HEPA filters that are suitable for use in childcare settings. So the grant programme opened for application on the 16th of December. Originally, the closing date was the 7th of January this year, but we've actually extended it out till the 31st of January, so as many services as possible could avail of the grant. So 4,109 services applied for the grant, and that's 95% of eligible services that made an application for this grant. So that 10 million grant programme is just part of a suite of supports which have been provided to the early learning and childcare sector since the onset of the COVID-19 pandemic. Other supports include tailored funding arrangements during periods of closures and restricted access to services, a range of capital programmes, an antigen programme, sector-specific infection prevention and control guidelines, and obviously access to the EWSS with an exemption to the turnover rule. And as we know, the EWSS rates at full rate is equal to 34 million investment per month, and the EWSS at the standard rate equals 22 million per month being invested into the sector. And that additional money has again allowed for sector-specific public health guidance to be implemented. Most, I suppose, importantly, the PlayPod system that has been implemented since the beginning of the pandemic. And there is strong evidence that these COVID-19 supports are helping or supporting the early learning and care sector. Recent TUSA data shows that the number of early learning and childcare settings that closed completely in 2021 has reduced significantly compared to the previous 2 years. And again, data from the Revenue Commissioners shows that the number of staff employed in the sector has held steady, and HSE data shows the rates of transmission within early learning and childcare settings have remained low, relevant to rates of community transmission.
Thanks. Thanks, Minister. There's one very vital piece of information that I don't think was contained within your answer, which I'd be interested in getting, which is how many of the creches, childcare facilities have HEPA filters installed. That's key information that the government absolutely and the Minister absolutely has to have. We know from HSPC figures released this week that there were 251 outbreaks of COVID in childcare settings during waves 4 and 5. And 7 of these outbreaks took place in the first 4 weeks of this year. And the figures I got from the hospital said it's 25 under 5 children in Temple Street at the moment, compared to 9 children aged 5 to 11. In Crumlin, there's 60 children aged between 0 and 5, compared to 24 between 6 and 11. We also know that the temperatures are in danger of, or are likely to drop again in winter, and in circumstances where you don't have vent filtration, the only protection that people have is having the windows wide open, whereas with filtration systems, you can have the windows, you still need to have them open, but you can have them open less wide for less long and maintain minimum temperatures.
Thanks very much, Deputy. I don't have the specific figure on the number of HEPA filters. I'll speak to my department and look and see if we can get that figure to you as quickly as possible. What I will say is that this grant scheme was designed specifically to deal with the issue of ventilation. We know that providers were very interested. Providers have been in touch with my department in terms of looking to see how we could facilitate them. We did facilitate them with this very significant grant, and as you've seen from the figures I cited to you there, there's been a very significant take-up of this particular grant. So I believe providers will have been going out to source these, implement these, and sourcing them in respect of the guidance that my department has provided in terms of what is the right type of filter, what is the right scale and size of filter for the particular settings that each provider has, recognising the very different size and scale of settings around the country.
Dr. Murphy.
Thanks. I mean, it does seem to me the fact that you don't have the figures illustrates the problem with this approach of establishing a grant and then creches and creche operators have to jump through various hoops to get the grant, then install it, as opposed to just simply going out and saying, this is important, we're going to centrally purchase the number of HEPA filters, appropriate HEPA filters that we need, and then distributing them into the facilities across the country. I mean, can you at least reassure me that some HEPA filters have been installed under this grant scheme? Because I know, for example, in relation to the schools, a couple of weeks ago, a similar grant scheme is in operation and not a single HEPA filter had been installed as a consequence. And the principals were saying, this is a long bureaucratic process, it'll be till the summer till we get there. Is the same hampering the rollout under this scheme in terms of the creches? And the final point I'll make is just the importance of long COVID. We know about 10% of people get long COVID. Obviously, many of them will recover from that long COVID, but it can particularly affect children, and it means it's vital we do everything we can to protect children as well as staff.
Thanks, Deputy. And look, I would say we have taken very extensive measures in terms of protecting children, and the grant that we provided this December is not the first grant. There was a 5 million outdoor play grant provided in June of last year, and there was just short of 30 million provided, a reopening grant in August 2020, just around the time I entered this role, to support the reopening of services following that initial large-scale closure. So very significant capital grants have been provided to childcare facilities all over the country to make them ready, to make those services safe. And I know that providers have implemented that. I've been in childcare facilities, I've seen the differences, I've seen the screens, I've seen the various provisions that have been put in place. And I've spoken to some in my own constituency, even in respect of the HEPA filter grant, who appreciated that additional support and the extra security and public health safety that provided. I don't think it's bureaucratic. I think we've made this available as quickly as possible to providers, and that's certainly the response I've gotten back from them.
Let's move on to our next question.